Dr. Saggu, my friend. Dr. Saggu is back. Yay. Hold on.
Good morning. Good morning, Kim.
Good morning, Dr. Saggu. How is it going?
Namaskar. Yeah, it's good. It's good.
Namaste.
Sorry,
Many blessings.
yes, please.
So
Namaste.
can you share with us what is happening in the medical profession?
Yeah, everything is the same. In medical profession, we are totally locked down. We are not doing our regular OPDs, but yes, we are seeing the casualties, emergencies, and we are seeing some corona infected patients, and we are referring all those patients to the government setup, which has been authorized by the government of India.
There something that we can do as a public to help right now besides stay home? Is there something that the medical profession needs there in India or anywhere else that you see that we can be doing right now?
Medical profession, yes, we are doing the research work. Even in some countries, the research work is going on for the treatment of the virus, and unfortunately, we are being hit by the another virus. Also, the news are coming from China that some hantavirus is also coming in. Even we don't have any treatment for the previous one, and now we are getting the other one also. So it's a bad news for today.
So can you explain to us what is the antivirus that you're speaking of? Is there several? Is there one?
Actually, if we talk about the virology, it's the same family which was the corona virus family. SARS and MERS was there, the same family. But the members of those family now the other viruses. So this is the novel virus which we are talking about, that the COVID-19. It's a mutated virus. There had been a mutation in the RNA synthesis of the same coronavirus, and it has. We discussed earlier that there is a species jump from the animal to human, and now in the human. And when there's a human virus and the animal virus is there together in one cell, and there was mutation during their replication cycle. In the mRNA, and because of the mRNA mutation, so now it is a mutant gene. The genome is mutant. This is a mutant virus, so that's why it was not coming in control. Another strain has come, that is the hantavirus. So we don't have much literature about this new virus, and hopefully in coming days we would be in good position to explain about this virus, explain about the structure of this virus.
It's taking time. We just need to be patient and stay home. Let the medical profession do their job.
Yeah.
And let you get it contained and understand how to do this. Give us again. I know I asked you to repeat this. Maybe we need to videotape this for you. But share with us again, and if there's anything new, some things that we could be doing at home to be proactive and protective. But if we're sick, if there's something we could be doing.
If we want to really understand about the structure of the virus and how it works and how it infects the human cells, because it would be strange for you that this virus it's not a live virus or it's not a dead virus. It is not matching in one category, but when it comes into the target cell in the ciliated epithelial cells of the human throat, then for its replication, for its production, this virus needs a cell, which is the throat cell, which is the throat epithelial cells of the human body. So, this cell has the, knob-like structures. The spikes are there on the outer envelope, and those spikes, they recognize special type of the receptor on the cell. And when this spike binds with that receptor of the epithelial cells, then it comes in contact, and then by endocytosis, this virus goes into the epithelial cells. And there is a synthesis of the genome again, there is synthesis of mRNA, there is a protein synthesis, because this virus has a total 3 or 4 types of the protein. One is the nucleocapsid protein, which is present in the nuclei another is in cytoplasm, and another is in the spikes, the glycoprotein. So all these proteins, they are specific for the specific receptors which are present only on the epithelial cell of the throat, human throats. Then there is a replication in this cycle, and then there is a more production of the viruses inside, and those viruses, they start shedding those viruses into the body, into the interstitial cells, into the lungs, and those viruses then start damaging that epithelial cells and damaging their lungs. You know, so now we understand that the spread of this virus is through the droplets. You know, because this virus is heavier. It is, I think, 400 micron, and the atoms in the air, they are 100 microns. So they are heavier than fuels of the air. So that is why they go down. They are heavier. So they cannot fly in the air, and they remains in 1 meter of the diameter of the patient. So when they goes down, they fell down, then they fell down on the surfaces. The surface may be your table, maybe your chair, maybe anything, maybe your hand, maybe your clothes, and anywhere. And from there, they can spread. So there is a new word, that is the fomite spread. So all these things, they are being said, they are being recognized as the fomites. So basically, this virus has a fomite spread. And if we talk about the fomite is, you can say, it's a type of the article where the virus can attach and can infect the another person. So you can say this is the messenger, or this is the carrier of the virus. Fomites is the carrier of the virus. So there can be, if we are roaming around outside the home, so there is a one category of the fomites. When we have isolated ourselves in the home, then there's a different type of the fomites. So the first category we talk about, when we are outside, we are roaming around, we are going outside, we are out of the homes, then even your specs, if we have touched the patient and then we are touching our specs, this can be fomite. Your purse, you're taking out your purse again and again, that can be a fomite. You're taking out your mobile can be a fomite. Your clothes can be fomite, your hair can be fomite, your turban, everything can be fomite. So wherever you touch the chair, table, they can be fomite. Whatever the articles you are buying from the market, your fruits, your vegetable, your plastic bags, they can be fomite. So all these things can have attached virus on their surfaces. Yeah, currency note. Your currency note can be a fomite. So that is why, I don't know about the others, but I have started doing everything online by card. So we are not using the currency notes now. So all these can be fomite. Now, the WHO has said that even you are isolated, you are not protected. If you are in quarantine, you are not protected. Why? Because while sitting in the home, you can have so many fomites. In the early morning, when your doorbell rings and you will get the newspaper, that is a good example of the fomite. Newspaper is coming inside. Milk bag is coming inside. The plastic bag is coming inside. Your frequent visitors, they are coming inside. They are touching their doorbell. They are touching their door handles. All these articles can be fomite.
Even pushing the button on the elevator, which has probably got more fomite germs.
Lift and the elevators. Yeah, they have ample space to become fomites. The visitors' shoes. Yeah, so all these can be fomite.
Your shoes. Walter, I've learned something even by watching you. And someone else, they were wearing a hair bonnet to protect their hair. You wear a turban.
My turban or cap or exposed hair, they can be fomite. So now what we should do, because we are coming from outside, because I went for shopping today, whenever because I didn't carry my purse along with me. My wallet was not there along with me, but yes, I was using my phone for all the payments. So I was doing, the cleaning of my phone every time. You have to clean your phone every time. You please don't touch your specs. Don't remove your specs. Don't hand over your mobile to anybody else. So whenever you come to your house, you keep your articles. If you have an ample space outside, put in the water, warm water, and then take all the bags inside. Remove your shoes outside your door. Don't take your shoes inside. Remove the shoes outside. remove your clothes. All clothes you have to wash it properly with the warm water, with the warm water, right? Then you have to clean your hands properly first. After removing your clothes, you have to clean your hands properly. Once you have cleaned your hands, then you can wash your face, you can wash your beard, your exposed hair. If you have exposed hair properly, you have to do shampoo for your hairs. You have to properly clean it, take a shower with the warm water, then you come inside. Now you are ready for your family.
That
On,
is
yeah,
probably the best advice I have heard. We talk about it, but that was so well said. To
yeah,
share that, be careful about touching the handles. Uh,
yeah.
you know,
So
I went to the store the other day. I took a wipe and made sure
yeah,
the cart. I didn't open any door without the
yeah.
wipe.
No, if you want to open, you open with your elbow. Use your elbow to open your door. And now, how can we disinfect our second type of the fomites? When you are isolated in the home, you have not gone outside, even though you are exposed to so many fomites. Number one, please ask your newspaper seller. I don't want the newspaper. I have enough news on my media. I can hear my news. I don't want to read. Stop your newspaper for some time. No problem. If your milk bags are there, clean it properly with the warm water, with the detergent. Clean it properly. Then take it into your kitchen. Clean your all the articles. Decrease the number of your visitors. We don't want any visitors. Please. Namaste. We don't want any visitors. Decrease the number of your servants. My driver is on the leave. Our maids are on the leave. Cook is on the leave. We can cook ourselves. We have ample time inside. What we are doing inside the home. So we can do everything ourselves. Whatever the fixed maid you can keep inside your servant. Otherwise, decrease the number of visitors. Don't ask anybody. Don't allow anybody to come inside and disinfect your whole of the house. You have to clean your table. You have to clean your doors, handles, everything. So three recommended solutions are there. One is the bleaching powder you can use. You can make a bleaching powder solution. Number two, you can use a sodium hypochlorite solution. That is very important. Yes. And one, the phenol for your floor cleaning. Your house properly, clean your doors because you have ample time. You don't have much work to do at home.
That's right. I mean, that's my favorite kind of cleaning anyway. I don't clean any other way. I like the detail clean. Everybody else takes care of everything else. But let's talk about the other things that in our lives, like when you're talking about cleaning the vegetables and stuff. But also talk about it. We hear that it could be aerosol, or we hear it could be airborne. Can you kind of share with us some facts about this to kind of disassociate the myth from the truth? Of what does aerosol mean? If it is aerosol, how does that infect us? Is there truth to that?
Yeah, there is two different things. One is the airborne disease. Airborne disease when the virus is present in the air, right? Then you can inhale through the inhalation by taking you breathe in. You can take your viruses with the air. That is the airborne disease. Droplets through droplets is when not by the inhalation. You can infect yourself by touching your hands to your face, your nose, and your eyes. Because this is a heavier virus, so it cannot float in the air. It will fall down, and through the surfaces, through the fomites, it can be spread. So this is not an airborne disease. This is the fomite spread disease.
And sir, do you want to mention about the MyLab test kit, which is approved by the
Yes,
medical
yes,
council?
yeah. Yeah, today the MyLab kit has been approved, and the beauty of this kit is that by the use of one kit, we can do the test for 100 people. So we don't have a literature much about this, but I think if this kit will be there in the market, definitely this is going to help us regarding the diagnosis of the disease. And today I think announced some private labs also being announced for the authentic lab for the test of the coronavirus, which we discussed yesterday or before yesterday. Uh, Now this test is available at the private labs also. So tremendous work has been done by the government of India, by the scientists in India, and by the medical healthcare. So now this test can be done in the private lab.
And how the test kits are different from the one which is presented by Yuvan the other day?
That was a rapid test. Rapid test detect only antibodies, and already we are in India. We are doing both type of the things. We are doing the antibodies also. We are doing the PCR also. PCR is a test where we can see the total volume of the virus which is present inside, so that this can be used as a diagnostic measure. We can use as a therapeutic measure. We can use as a prognostic measure also. We can see the response of the treatment. So I think this kit is also based on the PCR principle.
Okay. And sir, what do you want to mention about the Modi ji's press briefing today regarding the
Yes,
lockdown and
yes.
how?
Yeah,
Yeah,
now Prime Minister Modi has announced national complete lockdown for 21 days, and it's being till 14th April. So it has been announcement for the complete lockdown, because the some people during the lockdown they are not following the guidelines. So this is a strictness which has been given by the government of India. So now the government has to be strict, and all those people who are not following the guidelines, I think by this strictness they will definitely going to follow the guidelines. And some budget has also been approved by the Modi ji. PM Modi has announced around 15,000 crores for the patients of the corona, for the isolation beds, for the hospital, and for everything. So it comes to be around, I think, 208 million US dollars. So this is enough budget right now. In the coming time, I think we are expecting more from the Modi ji. And the tremendous work he is doing very well. Government of India, government of Delhi, all government of all the provinces, they are doing very well. And that is why the total number of the cases, they are not lying. They are not like going steep curve. They have a plateau curve now. Even the deaths are not much. 519 the total cases. Out of that, 485 they are the active cases, and the total 9 casualties we have in India.
but sir, I think the cases are down because we are taking a lot of precautions, and if we still stay at home,
Yeah,
I think
yeah,
we can manage.
that is why complete.
Yeah,
You know, if we talk about the life after this corona disease,
yeah,
tremendously there is a 360-degree change in the life. You see your personal life, you see your family life, you see your social life, you see your professional life. Completely changed life. The people, they have become more responsible. I can say more honest. They are following the guidelines. They are taking care of the hygiene, cleaning, and everything. And uh, now there is no difference between the rich and the poor person. They are on the
yeah.
equal level. Even the politicians, they seems to be on the equal level. So now there is no differences. There is no caste difference. There is no religion difference. Everybody is standing with the other person. If I have a I have a sanitizer in my pocket, I'll use this sanitizer for my friend before I use it for me. So we are
Yeah.
helping each other. That is why the results are coming.
But I think so. It's not about helping each other. We have to help people who are not helping as well. Because if someone, or maybe some people are not following the rules or not following the protocols, we are still struggling with the same situation. And that is what the
So
pandemic
I,
happened. Because,
I think Ankit will understand, and he will make you understand, Kim. There is a phrase in India, "लातों के भूत बातों से नहीं मानते." So that is why the strictness has been, implemented by the government of India. So strictly we have to follow the guidelines. Doesn't matter. We are not bound emotionally. We are
yeah,
not bound socially. We have to follow the guidelines. If we
yeah.
want to fight against this invisible virus, we need to follow the guidelines. I mean, you don't have to spend money. You have to spend your brain. Come on, yeah, you have to follow the guidelines. Yeah.
So, it's like I keep telling everyone, in order for us to survive this, we need to be educated, education, information, communication, and transparency. And Dr. Saggu, you're the first doctor, other than some articles I've read, but people don't really discuss what is this disease. It's a spiky disease, right? That's why they call it corona. It gets inside of you. I can't imagine what it feels like. We've had letters from people who are sharing with us while they're surviving the disease, what's happening to their bodies, the fever, So they're giving us report. Sasha, yes.
Yeah, Dr. Saggu, I have an interesting question for you as
Yes, please. Yes, please. Go ahead.
medical professional. I would like to understand from medical point of view. There are a lot of people these days, and just any days, especially these days, who are, how to say it softly, but let me be blunt, lying, especially a lot of politicians, a lot of charlatans who are proposing some drugs who have very questionable value or so on. In our age of internet, where you can easily check all facts and immediately, in a matter of a few seconds, to find out the fact is truth or it's a lie, why people are lying? Is it a sickness of some kind? What is it?
This is a human mentality. This is a mentality. If we talk about the psychology of people, so on the back of the mind, maybe subconscious mind, they are in nature of hiding the things, lying the things. Even then, they know that they cannot hide their lies, but even they are lying.
So
This is a psychology.
it's a pathological issue, right? It's a pathology.
You can say a pathology. I mean, not a pathology. It's a psychology. Basically, psychology. Pathological, there is no problem with the brain, but yes, psychologically, that they have a problem.
Is there a cure from that?
I don't think so. Dr. Saggu, you're the doctor.
If somebody will invent
We need a cure for that. We do.
Somebody will get a Nobel Prize for inventing a medicine from lying.
I don't think we should go on that side. That will divert our pathway.
We have a cure for those who lie. No.
Yeah, I can understand your indication clearly, Sasha.
Okay, I'll tell you what's the problem. My late grandfather used to say that if you will open in the center of the city, in the most, in the best populated area of city, a store which would sell brain, that store would go bankrupt very quickly because nobody would admit that he needs brains. Unfortunately.
Yeah.
So nobody would buy medicine from lying. Because nobody would know he's lying.
Yeah.
No, I think there's no real cure for lying. I was trying to pull up my favorite picture, Ralphie with a bar of soap in his mouth. As little kids, you know, I grew up in and had a Catholic. I was in Catholic school for a while. They would, you know, pop you on the back of the hand if they thought you told a fib. Your mom would make you eat a bar of soap. But, you know, I think that killed most of us if it didn't cure the lies, right? But there is a pandemic hysteria. People are in survival mode. The animalistic mannerisms of humans when they get to the point of panic and trying to survive can be very unhealthy environment. I think staying home is the best way to do this. But you have people who don't think that way.
Yeah, but even then, there is a lot of change of attitude on the positive side. I have seen. I cannot say about the other countries, but yes, in Indian population, in Indian people, whatever the attitude they were having before Corona, and now they have changed. They are in the helping mode. They are. I mean, I cannot say 100% people are like that, but yes, more than 90% people are like that.
You know,
Dr. Singh, you want to mention about the Gurdwaras and how they're helping the people around the world?
Yes, I mean, even the US government has also asked the Sikh organization in US to make a food for the people who are suffering from the corona. So the lot of the Sikh organization, they are doing this type of the services to the corona patients. And I think we should be combinedly, we should come forward and we should serve for all those people. And I should salute all these the communities, whether it belong to Sikh communities or some other communities. But yes, they are doing all these services, and that's good. Even in India also, I think gurdwaras and temples, they are the main places where the patients, they can have a shelter over there, and even they have some isolation rooms also. They are keeping them in isolation there, and serving them food, the daily essential necessities they are giving them. And I must say, I must thank all those organizations all over the world.
And also,
Well,
we
and
were discussing about the role of a WHO. That we are not sure that they are playing the right role. But because what I've seen that there's a lot of difference in infrastructure between countries and compared to medical care. And when I know in India that we are at 140th place as compared to Italy, which is the second position in the healthcare. So why we are not working on the healthcare system? Because we are busy buying the defense equipments every time. To showcase our power and all. But we are not focusing on the medical budget, and it's not about India; it's about the globe. Because
Yes,
because
yes.
I was checking the facts
You,
that all the countries around the world, they just have 5% of the ventilators as compared to the population of the country. So if some crisis will happen at some point of time, at least we should have 50% of the ventilators or the equipment ready for the public. And we are paying
yes,
a lot
yes.
of money to the health insurance companies, to a lot of people regarding the healthcare, and we are not getting the required healthcare when required. And the insurance in India, you know that they have stopped doing the COVID insurance cover because they said it's a pandemic and we can't cover it. So people have to pay a lot of money to survive all these things, and how uh, a regular person can do so. So I think that
Yes,
you think we need to work on the WHO position at this point of time.
yes. I think I'll answer your second question first. I think the Ayushman Bharat policy is covering the COVID-19 patients.
Yeah, but
I
it's
think
not
they have
for
announced that.
not for
I think they
it's
have
not for
announced
yeah, they've announced, but
that.
it's not for the whole country because Ayushman is already available only to those people who have the BJP government ready right now. So it's not
Yeah.
established in all.
In some countries, the Ayushman Bharat is not there, but where the Ayushman Bharat is there, they are covering all this under the insurance, and that is pretty good. And
Yeah,
now the answer to the first your first question is, I think there are two types of studies. One is the antegrade studies, and another is the retrograde studies. So, by retrospective, because this type of the pandemic has happened first time in my life, I can say. In my life, I
okay,
have seen this type of the pandemic in my life, and now the all the governments of all the countries, now they are going to think upon this retrogradely, that what what is the result of their investment. If they would have been invested on the hospitals, on the
yeah,
diagnosis, on the medical professionals, paramedical professionals, on the healthcare, then there might have a different scenario right now which we have. So retrogradely, they have to think over the. We have lot of high thinking people. We have already we have elected, because it's a democracy. We have elected them, and now they are going to think over it, sitting in a parliament. So they
yeah.
will think over it. If they will not think, then I think we can have a policy to make them pressurize for that. If they can have a thickness to ask us to follow the guidelines, the same way we can also pressurize them to announce more budget on the healthcare, more budget for the hospital, more budget for the healthcare personnel, paramedical staff. So now we cannot think about the past. We can only think about the present and the future. And I'm sure that future is going to be bright.
And my concerns were, I was discussing with Kim and Sasha as well that can't the WHO do some kind of standardization for the countries across the globe that this is the medical standard and you have to follow the standard regularly? Can we do
Yes,
something like this? Because
yes. I think now the WHO will also see the scenario all over the world, and they can also make some type of the strict guidelines regarding the healthcare.
So, doctor, I got another fact that I want to work on here. And the results that we're getting today are from tests that were probably taken 10 days ago, because it takes us 10 days, almost 7 to 10 days, to get those test results. So the results of the cases that exist today are really, from what I can add, from 7 to 10 days ago. So actually the cases that we have today far exceeds what we see. Am I right?
Yeah, yeah.
So this is something we really need to look at, that the
It is,
contaminated cases are much
it is
higher.
touching almost 4 lakhs now.
Excuse me?
Yeah, it is the total number of the patients they're touching almost
400,
4 lakhs. 4 lakhs, yes,
400,000.
almost 4 lakhs.
So
400,000.
So it's probably far above that right now because we're still testing cases that haven't
Yeah,
come in
yeah.
yet.
Some even in India also, I have heard a lot of patients who are the foreigner travelers and they come to India. They came to India last to last week. They are hiding themselves. They are not coming out. They are not going self isolation. So I think more and more people would be coming when we are getting them all investigation done, because now I think the enough kits has been available in India.
No, so in America, we've learned that they don't have enough kits. In New York,
Okay.
the rate has jumped so high in New York, it was like 20,000 yesterday.
Oh,
Yeah, from resources I have. I mean, I don't know how real those resources are.
yeah.
Say one thing, you know, they, but I don't think our testing is keeping up with the data being collected, which is something that Willie has tried to touch on many cases. Is that we need more data faster.
Yeah.
The rapid test kits. Do you think that that's going to make a difference?
That can make a difference for the patients who are in stage 2 and stage 3. At least we can identify all those patients.
Right. So, I mean, these are small steps, right, that we can start pulling together so that we can make bigger steps. So these are the small steps. But the biggest steps we can do is stay home, sanitize ourselves,
Yeah.
understand what can be contaminated. Our whole body can, our hair, our
Yes. Yes.
clothes. So take them off at the door. Leave your
Yes. Yes.
shoes at
Yes.
the door. These are all old practices from old world. Even,
Yeah.
even we used to have to leave our shoes at the door. I used to think it was because my mom didn't want to sweep up and clean up after us. But coming in, a bunch of kids, leave your shoes at the front door. Leave your shoes at the back door. Don't track in the dirt. I
Yeah.
just
Yeah.
clean the right?
No problem if you are keeping your shoes in front, on the front door also. Keep
Right.
outside. Doesn't
Keep
matter
them
if it's
outside.
valuable or not valuable. Yeah.
Right.
Keep
Especially
it
if you got
outside.
a little rain catcher. Keep them
Yeah.
outside. Um,
Yes.
shower once you come home. And these are
Yeah.
practices that doctors seem to have too. A lot of doctors make these practices their daily part of their life because they don't want to contaminate their families. When I worked part time for the power company as a college student, and we had to go out to the nuclear power plant, we had to shower when we were done, right? Even though we had the containment suit, we had to shower, change our clothes, because they didn't know what kind of contaminated. But we had to clean before we went in too, and we had to put the suits on. So it's all about protecting you from the environment, but also protecting the environment from you. And
Yes. Yes. Vice versa.
right, I still believe in the mask, right? But like you said, don't touch your glasses, don't touch your mask. I mean, I am now, but this has been inside for a while, and it's probably contaminated by now. But wear your masks, change them out, clean them, wear your
Yeah.
gloves, make those priceless, right? Make them get their dollars worth, but wash them too. I
Yeah.
learned when caring for my mom, who was very, very terminally ill, we had to wear layers of plastic gloves. And when we touched something, we had to tear off the layer and put it in the trash can. I
Yeah.
noticed
Yeah.
my doctor's doing this during my procedure I have to have once a month. When they touch something, they change their layer glove and then they do something else. And these are
Yeah.
practices that they learn that even in your contained environment, you can still transmit diseases. So I learned a lot from just having to wear layers of gloves and change them. And before you get to your last layer, put more gloves on. But your gloves can become contaminants too because they're your hands and you're touching things. But they help, right? Rub the gel on the gloves, clean them. Hot water, hot water sanitizes. Drinking, you had shared with us too for days. Hydration, right? Hydrate our bodies. And we still need to build our immunity. I know Ankit and I think we've got a bet going on here. Who can drink the most during the show? Because we're both constantly drinking. I now bring 2 cups, one this big and one this big on my show. Whenever I see Ankit take a drink, I take a drink. These are very important to flush our body out. Bananas, yeah. I finally put mine turning brown in my bowl. But here's another source, right? Apple a day keeps the doctor away. But doctor, it has skin on it. And when I pick it up in the market, it might have those contaminants. How should I wash it or should I peel it? What's the best way to do our fruits and vegetables?
You have to today I washed my vegetables. I bought some vegetables, and then what you can do, you can put your vegetables in warm water, and you can put some acetic acid or sirca on this. We say acetic acid we can put on this, and properly you can clean it. So that is the best way to clean your vegetables and fruits. You have to clean it properly before putting into the refrigerator or before putting on the shelf. You have to clean it. Yeah.
Can we use a hot towel as well to clean the vegetables?
No, not towel. So whenever you are coming from outside, you are not going to use your towel. If you want to use to dry something, you can use a tissue paper, and then you have to discard it properly. So those germs you're going to transfer on your towel, and then towel can also contaminate your other surfaces in the house. So please use your tissue paper. It is recommended.
Okay.
That is very good advice, doctor. Just like your advice if we're using cloth.
Yeah. Kim, I want to make a comment. Yeah, I want to make a comment here. We were talking about the social distancing. I think 3 distancing are more important. One is the family distancing. Whenever you are in the house, you have to keep distance from your family member also. Then you have to keep your physical distancing. Physical means when you have gone for the supermarket, you are in the queue. So try to be in a distance of more than 1 meter from the other person. Number 3 is shopping distancing. Try to avoid shopping. I'm very happy to say today to my wife also, please don't shop. The least number of the articles you will buy, you have a least probability to be contaminated by the viruses. Please do less shopping, buy less articles to the house, and come to your house with less fomites. Less fomites will give you less infection. So please keep your shopping very, very less.
So right now, I mean, people who are shopping, they're mostly buying the groceries.
No, they should not be. Yeah. There are 2 reasons. One is you are going to infect. You are bringing the fomites into your house. Second is you are not keeping that grocery for your neighbors, because you need that grocery, and your neighbors, they also need your grocery. Other people also need the grocery. Keep some grocery for them. Please bring less number of the items or the articles into your house.
So we can also do one thing. We can keep the grocery outside, and then whenever we record, we can bring it back to the home.
Yes, you can do one thing. Yeah. Whatever the grocery, if you can keep those groceries outside your house for 24 hours, that is good. Yeah. Keep there for 24 hours. Let the viruses shed off from your grocery, and then you can bring the grocery into your house.
If I did that, the raccoons would take over. Oh my gosh. And the bears. You know,
no, actually, you know, in India, we have some sort of storehouses in the parking area that is outside your house. Even we have a parking area, we have a storehouse there, so we can keep the grocery there. That is also locked, so you can keep your articles over there, and you can bring all those articles next day.
Smart
That
idea.
is very important.
You can put it in your garage, and then after 24 hours, you can bring it back to
Yes,
the
yes, yes.
house.
That is also equally good. And one thing I want to comment is we talk about the social distancing, all type of isolation we talked about. We talked about the hand hygiene. That is very good. And we talk about the immunity. You have to boost up your immunity. And number very important for the elder people. As Kim, you mentioned that your mother is there in your house. So it
But
is very important to
she passed away. She's not there. But if she was, let's talk about it. If she was.
Okay, so you need to keep your all the diseases under control. If you are diabetic, take your diabetic medicine in time. Take control your sugar. That is very important. If you are asthmatic, your bronchitis is there, then keep your inhaler in time. Keep your breathing properly. If you have renal disease, if you are on dialysis, please keep your creatinine level, your kidney functions at the normal level. If you have obstructive sleep apnea, please use your BiPAP or CPAP. So whatever the disease you have to keep all your disease under control. Because if they would not be under control, your immunity will go down. If your immunity will go down, you will be more prone to have a coronavirus disease, COVID-19.
I
And then
agree with you. And
I want
also,
to make 2 points. Yeah, I
go
want to
ahead.
mention 2 points that see, I mean, we are getting a lot of stuff from outside the country and especially from China. So what the government have done is they have quarantined those big containers, which we use it for the importing the stuff from China. And after 14 days, those containers will open. So that is going on from past 2 weeks, and that's why we don't have enough supply from China because whatever supply was there in between while the COVID was going on, so we have blocked those supplies, and they are quarantined at the port. And after 14 days, we will open those containers. And
Okay.
secondly, there are 19, I mean, travelers visiting India from Italy, and 10 of the Italians, and then they are going back to the country today.
My,
So,
yeah, my
so it's
battery
been
is
after.
going down now.
Yeah.
And my battery is going down, so anytime I can, my battery will down.
Okay. Okay. No problem.
Yeah.
So,
These
so
I
basically,
agree
I
with you. We
wanted
need
to.
to keep up with the medications. Um,
Yes, yes.
so get them mailed to you if you can
Yeah,
in your country.
yeah,
Um,
yeah.
in
Um,
my situation, I have to have treatments at the hospital once a month. But because of
yeah,
this, I no longer can receive my treatments.
yeah.
So I have to find an alternative, which I doubt there is. So, I'm doing what I can to maintain my immunity, to keep my immunity up. So, if I can't get my treatments, which I've already been told we can't, but this is what's happening, folks, because people rush to the hospitals with fever and you contaminated the room, you made more people sick. The people who really need their daily treatments, they can't get
Yes,
them
yes.
anymore. Our hospitals have banned everyone, but the
Yes,
people
yes,
who
yes. We have
were
also been there.
already treating that were dying and women that are having babies. That's it. The only people they're accepting right now are people who are already dying and already patients. So
Yeah.
the way people acted hysterically towards this is hurting the people who need other treatments daily anyway.
Yeah.
People and doctor, you know this. They can't cure the flu. Don't go to the hospital with the flu. Don't go to the hospital with this virus in fourth stage.
Yeah.
Stay home and call. They're saying
Yes,
call.
yes. Yes,
Stay
yes,
home,
yes,
use
yes.
the phone. Stay
Yeah.
home, use the phone.
Stay home. Yeah.
Sasha,
Stay home. Use the phone.
stay home, use the phone.
Use the phone.
Right. We
Yeah,
need
yeah,
our ambassador. We need our
yeah,
ambassador singing this. Okay,
yeah.
Sasha.
Dr. Saggu, I have one question for you because there is a huge political battle going on between the state of New York and federal government. There are shortage of ventilators, apparently 40,000. And yesterday, the governor of New York declared that unless in 10 days 40,000 ventilators will be delivered to hospital system of state of New York, people will start dying in large numbers. And if you remember the statistics, which we looked at a few minutes ago, it shows that New York is outstanding of all states by number of infected people.
It's a maximum in the US, yeah.
Yeah. So, what is importance of this ventilators and why it's such a huge problem?
Yeah, yeah. Sasha, there is a not no treatment for this COVID-19. But yes, what we can do is a supportive treatment. In stage 3 and stage 4, the patients have severe pulmonary fibrosis. They have fluid in their lungs. And because of that, there is a hampering of the oxygen and CO2 transfer at the alveoli level. So the saturation of the oxygen is going down. When there is saturation of the oxygen going down, and the other characteristic of this virus is what it is doing, it is damaging the ciliated epithelium of the throat. What is the function of ciliated epithelium is cilia, they protect us from the outside pollutants, plus they are cleaning the mucus fluid from there. If there is a damage to that throat cells, the mucus will be deposited in our windpipe. The mucus will be deposited there. They will obstruct, and because of that, we cannot breathe in and breathe out. So there are the two principles. One is the obstruction is here. Another one is there is the hampering of the oxygen and the CO2 transfer at the level of the alveoli. So both the things are making our breathing very, very critical. So ventilator, what the ventilator does, ventilator gives us the breathing at the pressure. So with the pressure, they are giving breathing inside so that the obstruction can be taken care of by the use of the ventilator. So when we talk about the symptomatic treatment in stage 3 and stage 4, the answer is ventilator. That is the external support respiration, positive pressure respiration, PPR. So that positive pressure respiration is needed in stage 3 and stage 4. So that is why we need a ventilator. If we don't have a ventilator, we cannot give the supportive respiration to the patients, and patient will die because of low saturation of the oxygen.
Thank you so much, because I've heard so much about this issue, but from medical point of view, I really didn't understand what is importance of the ventilators. Thank you so much for explaining that.
Yeah, thank you, Sasha. It was a very good question.
Well, and it is because we need to understand what the treatments are, how they affect us, how they impact us. Are there self treatments we could do at home? Would the inhalers help people who contracted this disease? That might be something we can do. I've had to use the inhaler many years ago when I had bronchitis. I never had to use it before, but boy, did it open up things for me, calm me down, and help me breathe again.
Yeah.
I never, I don't need it all the time, never needed it again, but at that one moment in time when I was sick. So, are these things that maybe we can start focusing on in the future?
Yeah.
So, I mean, because we see that there's not enough resources. So,
Yeah.
home treatment is where this is going to be beneficial, right?
Yeah, it's only the symptomatic treatment which we have. And as we discussed that in stage 3 and stage 4, there is definitely an intensive care unit is needed. And all those intensive care units, we need ventilator and all those things. So that supportive treatment is only available. Isolation is the best. Prevention is always better than the cure.
I don't know if this is happening in India, but we heard stories where they're having to make decisions that are horrifying for doctors: who lives, who dies, who gets the treatment, who will not. Have we seen that in India yet? I know they did in Italy. What about India?
No, can you please repeat your question? Yeah.
Ankit.
So, sir, yeah. So I mean, in US, what's happening that people who are little old, so they are not getting the treatment as compared to people who are young, or maybe there are some differences in choosing that who is the right patient to get the COVID treatment done. But do you think we are something similar in India? Because I don't think so. We are following the same that rule,
Now,
and we are
one
trying.
thing, yeah, one thing, when we talk about the treatment, uh, we are not biased for anybody, whether on the basis of the age, on the basis of religion, on the basis of severity. So, whosoever, according to the guidance, needs intensive care, we are putting those patients in the intensive care unit. Whosoever needs the ventilator, we are giving them the ventilator. So, I don't think these type of things are being practiced in India.
Yeah, we don't practice such things basically, and we always welcome, because you won't believe that so many patients have reported for COVID, and we have treated around 20 patients who are not from India. They are from different nationality, and we have
Yeah,
treated
total.
them.
Yeah, total. There was 26 patients. 26 patients
Yeah,
were the foreigner patients, and other patients
yeah,
they were the Indian patients. And
and they all
you
went.
would,
There is equality from international patients. So that is
yeah,
what we have done so far,
yeah.
and
Even
we
even
always
even
welcome the guests.
yeah.
Basically.
Initially, the complete treatment was given to 4 patients in Jaipur.
Yeah.
Out of 4, 3 were the Italian patients. And the first patient who was discharged from the hospital with the negative viral load or the low viral load with the negative test for the corona after coming the positive was the Italian patient.
You
So
know,
there was also a rumor going around that people who are, who are negative in after the treatment, or they are cured from corona, they won't get the virus effect again because they have that antibodies fighting with the virus, and they
Yes, yes,
can't.
yes. Yes, yes, yes. So,
Yes.
I mean, our body is the best treatment for everything. We have a lot of immunity. We have all the Department of Defense inside our body. So, our Department of Defense is working well. If our immunity is good, then even the mild symptom or the moderate symptoms, they will go without any treatment. And only those patients who are critical, stage 3 and stage 4 for intensive care, only those patients need some supportive treatment. Otherwise, the virus can be destroyed our body. Virus
But
is nothing in front of our body. Yeah.
can the virus disinfect anyone again, or it's just one of the case?
Sorry.
Can the coronavirus disinfect someone again after the cycle?
Same patient. Same
Yeah,
patient.
same patient.
No. If we have enough antibodies, then there is no chance of another infection.
Not, not,
If
not
we
for
talk
a
about the general.
not for a smaller period of time, maybe for second season or maybe later on as well. I mean, at some point of time, once they lose the antibodies, so there's a chance that they can be more prone to the virus.
So, because we don't have enough literature for coronavirus, if I give
Okay.
you example of smallpox,
Yeah.
you have heard about the smallpox. If you have a smallpox infection in your childhood, you cannot have a second smallpox or herpes infection in your whole of your life. So
Okay.
immunity is there because the same is responsible for the smallpox and same responsible for the herpes. So
Okay.
our bodies have a lot of every type of ministers we have. We have defense ministers, so many defense
Yeah.
ministers inside. So if our defense ministers they are working well, I think we can fight with any type of the viruses.
Okay. That's good. That's a
I
good news.
agree with you. Yeah, and I think we need to start sharing this worldwide. We need to
Yeah.
start
Yeah.
sharing the research worldwide, put down our differences, and save the world, not just one place. And what India is doing, the permanent lockdown for 21 days, that's awesome. I think it's going to be. I
Yeah.
think it needs to be longer,
Yeah.
but I think people can't stand the thought of 20, being isolated anyway. Um, but I think in 21 days we can quickly isolate who has it, who doesn't. Save your homes, clean your homes. Now's the time to spring clean. I don't know what time of year it is in your country, but spring clean. I know people are having their food delivered to their door. Like you said, leave it sitting outside and let the contaminants die away before you bring it in. Let's talk about this. I brought up the raccoons. I noticed the animals are acting really weird lately. I have a lot of nature where I live. And I think I saw the deer standing in the street dancing. Woo-hoo, nobody's going to run over me. Uh, but, I think nature is affected by this too. I think the animals are like, where are the people? The people are not at the parks feeding the squirrels. And I think nature's going to be impacted.
Something coming from the animal infecting the human body is all because of the nature. All because of the nature.
Right.
Yeah. The
And I
species,
think
because of the species jump. Yeah.
But I think nature's feeling our change as well. I think they're going, wow, where's the humans? The cars aren't on the street. The humans are at home. Is there something wrong? Nature reacts to us. We react to nature, right? So we assume this is
Dr.
zootronic.
Saggu Dr. Saggu is leaving because I think it's time the battery is going down. So maybe he'll join next.
It's going out. So I would thank you very much.
Many
Yeah,
blessings.
I would like to mention here one thing while I'm going, that this type of the disaster, we can say, this type of the critical situation is there. This is a very scary environment with the peace. It's a peaceful and the scary. I have not seen this, any other type of a disaster like this. Because if there is a disaster, it is scary and noisy. Lot of noise is there. But this is the only disaster where we are peaceful, we are locked in our houses, and we are scary also.
I agree. We've never seen anything like this in our life. I think the biggest damage is the panic of the people, not so much the just the virus. Thank you, Dr. Saggu, for
You're welcome.
sharing with us. Many blessings, and love and peace to the world.
I would also
Let me know.
Dr. Saggu that,
Love and peace.
can we invite ma'am as well on the show sometime whenever she's available? She is a cancer surgeon, Dr. Saggu's wife, and she deals with women cancer oncologist treatment. I mean, and
She's a surgical oncologist. Yeah, she's a surgical oncologist.
But I would like to ask you, have you ever seen the movie Contagion? It's a movie by 2011.
Yeah.
About the virus.
It comes so close to describing what's happening now. I just saw it days ago by advice of my daughter. I was impressed, really, what I saw. I never seen it before. What about you, Kim and Kit? Have you seen it?
I've seen a lot of them. I made a joke the other day. I don't think people thought it was that great of a joke, but we, a lot of these movies remind me of what we're going through, how people panic can cause more dangerous things to us than the disease itself. But yes, it's very similar. A lot of the movies show us how humans sometimes misreact. I think what we need to do is focus on things like this, communications like this. Join hands. Don't watch so much TV. That's right.
Join hands. Yeah. Join hands online, not offline. Online we can join. Yeah.
Join hands. This is what I tell Ankit. This is how his daughter needs to learn to date, right?
Yeah.
This is how we date.
Yeah. Thank you. Yeah. Thank you so much, Kim. It was a very good discussion.
Thank you.
Thanks for making me part of discussion, Kim, Sasha, Ankit.
Thank you very much.
Namaste. Sat Shri Akal.
Stay safe.
Many peace. Take care.
Take care.
And kids, I appreciate Dr. Saggu joining us. I think that there's much to be learned from people all over the world.
Yeah.
Doctors like this that are sharing with us.
So next time I'll make sure that Dr. Saggu will discuss about the HIV patients and how they treat it and what kind of precautions they follow, because I forgot to ask him again.